That was April 12th of this year, 2023. So, and that was my last day at work. That was my last day at home, and and I did not leave the hospital. So that was tough. Like, I had no idea. Hey guys, it's Shawnee B. Welcome back to another video. This video will be about my birth story with Jeremiah. So that's what I'm going to be talking about, my pregnancy and my birth story. And so I'm going to do like the complete story and different parts. So be on the lookout for the videos following this one. So it'll come, but I probably will release it like once a week. So yeah, so let's jump into this video. How I found out that I was pregnant with Jeremiah. I was at work actually. I was feeling fine, and then out of nowhere I started feeling nauseous. And normally when I feel nauseous, like, I just do some like deep breathing, some meditating, you know, like trying to like, you know, let it pass. Oh, my goodness. Trying to let it pass and whatnot, but it didn't. Anyway, long story short, because I don't know how much longer this little guy, yes, will let me tell my story. Yeah. You gonna say hi to the people? Say hi to the people. Say hello, peoples. Yeah, so I will be 8 weeks on Sunday. My name is Jeremiah. Jeremiah. Yep, and so I'm gonna be 8 weeks, and I'm a little chunky. So I'm probably about over 8 pounds now. Yeah. Yeah, so I'm over 8 pounds. You gonna sit up? Say just a little bit. Say hello, peoples. He said, what is all of this? What is all of this, Mom? Yeah, that's what you've been doing in here. I came home early, and my husband was, laid down or whatever. My husband was like, yeah, don't, he's like, I don't think you should take a test because that'd be wasting money. And I was like, yeah, I agree. I'll wait or whatever. And I couldn't really remember, none of my cycle information. And normally I'm really on top of it, but I didn't remember. So I'm like, okay. But then I was feeling bad the next day, and I was like, you know what? I think we should test. And he was like, nope, it'd be a waste of money. So I decided, that was a Wednesday when I got sick at work, and then on Sunday I tested and it came back positive. So we were both shocked. We were like, what? Because that was not like in the plans. Oh, you know what? Before I go further, I got a couple things I want to hear from you guys about. One, I want to hear how'd you find out you were pregnant? When did you find out you were pregnant? I don't even think I said when I found out I was pregnant. I found out I was pregnant when I was, I want to say I was about 5-6 weeks along. In every pregnancy, I always find out super early, which irks me because it seems like the pregnancy goes on forever. And I'm just like, what the world? And so, yeah, so that's one thing I want to know. I want to know your pregnancy story. Like, tell me when you found out, how you found out, what was your symptoms. And yeah, make sure you comment that down below in the comments. First trimester, normal stuff or whatever. I won't go into that too much. But I will say that we were hoping that this little boy was our little girl, and we ended up finding out in December that he was a boy. We did the NIPT testing, non-invasive prenatal testing, just because they recommended it because I was 35 and they wanted to check for any like abnormal chromosome disorders, or any abnormalities, and then the chromosome disorders. So like trisomy 21, which is Down syndrome, trisomy 18 and 13, and there were some other things that they tested for as well. But everything came back, and when they called me, they were like, did you want to know the genders? I'm like, yeah, because I'm like, this has to be a girl because I just felt different, and I was actually getting sick and vomiting and all that jazz, and she was like, it's a boy. I was like, a boy? Like, another one? She said, another one? I said, yeah, I was coming. He said, yeah. Oh, well. So yeah, so that was in December, so that was before my 20th week. I seen the high-risk doctor because of my history. So I got ultrasounds pretty regularly, like every 3 to 4 weeks. And then my blood pressure was rising. So they were like, oh, do you have high blood pressure? Did you have it at any point? And I'm like, no, I don't have high blood pressure. Like, have I had a couple elevated readings, yeah, in the past, but I've never taken blood pressure medicine or anything like that. And so they made me do a 24-hour urine collection, and then that came back. I believe it was like 90, which was normal. And then so they just kept an eye on it, had me check my blood pressure like every 2 weeks or whatever. They started me, I believe, February. I started the baby aspirin, or maybe January. I started the baby aspirin, and then I started blood pressure medicine because I was just like borderline, like 149, 148, over like 100 and something, or high 90s. And so it just got to the point they were like, I felt better if they would just erred on the side of caution, and they did too, like just to start me out on something that's preventative. And so so I started on labetalol, I believe it was labetalol, twice a day, and then I had the baby aspirin once a day. And so yeah, but that was after I was 20 weeks. Before that, they were just kind of like, let's just see. But after your 20 weeks, then they start looking at things a little differently. So yeah, so I started the baby aspirin, and then in the blood pressure medicine, everything was going good with that. So my only qualms about the blood pressure medicine was that there were times where my blood pressure, but I would take my blood pressure and I'll be doing fine in the morning as long as I ate and I took my blood pressure. I was okay for the most part, but then there were times where when I would take it and it was okay, but then it would like it would drop. My blood pressure would be low, and then I'd get dizzy and feeling lightheaded and everything else. And only one time did it really happen pretty significantly to where I had to like lie down because it was like that bad. But outside of that, and I think that's when I went to the doctor and I told them about it, and they said I told them I was only taking it once a day because of that, especially in the morning. I would take it at night, but not in the morning. So, and I told the high-risk doctor that too, and he was okay with it at the time. So I was like, okay, cool. So that's what I did. And so far, everything was good. I was still monitoring my blood pressure twice a day. I just was only taking the medicine once a day. And then I think I had one ultrasound visit where they saw, or not one, it was an ultrasound visit where they saw it's called a choroid plexus cyst on his brain, and which is a cyst in the brain, but it was ruled, they said it was pretty normal. It was normal for it to be there, and that normally by birth it resolves. And so, so it resolved. The last ultrasound that he had, I was in the hospital. I was getting ultrasounds like I was getting them twice a week. So I believe ultrasound days are Mondays and Thursdays. I don't know why my hair is doing this. We're like Mondays and Thursdays. So I was getting ultrasounds that frequently, and then they were checking and all that stuff. So it resolved. And let's see, the high-risk doctor visit. So I was doing those starting in December. I did those every 3 weeks, 3 to 4 weeks, and then my regular OB wanted me to basically be seen like every other week with rotating my my appointments so we can keep an eye on my blood pressure. So so pretty much it worked out that way. So yeah, so that was the first part and somewhat of this. That was my first trimester, and then somewhat of the second trimester. Outside of that, it was pretty much. Second trimester was pretty kind of like, it was cool, besides the usual, aches and pains and whatnot. And I didn't really have any issues for real besides the blood pressure. But then I did go to triage 2 times, which is a record for me because with my middle son, Malachi, and MJ, I was at triage a lot more than that. So, but this time around, I believe it was only twice, and mostly because of like contraction, like pain. The second time that I went, it was because I was having like contractions, and then I thought my water broke because I was in a work meeting and I felt the gush. And so when I went home, I called and they were like, yeah, we'd rather you come in and get checked out. That was April 12th. So April 12th, I was 31 weeks and 4 days. like I said, I went in. I thought my water was leaking, and I thought I was having contractions. And so I went in that evening. I went to L&D triage. I was having contractions. It was not my water. And then my blood pressure started acting up. It was like 150s, 160s over like sometimes 100s or 90, high 90s. So anything, I believe, greater than 150 is treatable. And so I kept getting consistent high blood pressure readings. I'm like, I don't understand, because I was taking it at home. Everything was fine. Now I'm here and it's going through the roof. I was like, what the world? Like, I'm fine. Like, why is this now all of a sudden now acting crazy? So anyway, so then they were like, well, we're going to do a 24-hour collection, urine collection, and we'll keep you overnight to see what your blood pressure does. So I'm like, okay, overnight, not bad. Did that before with my second son. So I was like, okay. Well, did a 24-hour collection. I believe that next day, the high-risk doctor comes in. They moved me to an L&D room. He comes in and he's like, yeah, he's asking me like all these questions as if like he didn't see me like this whole time up until this point. So I'm like, whatever, I'll answer your questions all over again, even though you should know, but whatever, I digress. So, but then like, he's like, okay, he's like, well, if there's any protein in your urine at all, you're not going anywhere. And I was like, excuse me? Like, what does that even mean? And he was like, we hope for the best, but yeah, any protein, you're not going anywhere. And then he proceeds to leave. Like, he didn't explain, he didn't go into detail, like nothing. After that, I did the 24-hour collection. They moved me to an antepartum room, and me and the nurse, it was at night, and me and the nurse were talking, and she was saying like, yeah, typically, if you have higher urine, like the cutoff for this hospital was 300. So if it's 300 or higher, you would be admitted until delivery. And I was like, what? And she's like, yeah, because that's indicative of pre-E. And so they want to keep an eye on you just in case they have to deliver you early, because preeclampsia, it can sneak up on you. Everything can be going just fine, and then boom, out of nowhere, it starts getting wonky, and it can get wonky fast. So they rather you be here and keep an eye on it and try to if it starts getting crazy, to start doing interventions right away. And she's like, so that's what the doctor meant by you're not going anywhere, is that if your protein in your urine is high, then yeah, you'll be here until delivery, and they recommend 34 weeks. I'm like, what was that? Why was that so hard for the doctor to tell me? Like, why couldn't he just say that instead of saying, you're not going anywhere? Like, why couldn't you just tell me, like, this is what it is, this is what it's good. You know what I mean? I mean, I could have pushed more, but I was just kind of like, whatever, at that point. Well, yeah. And when he came in, I was just kind of like, whatever. We'll just see what it is, because you're not going to tell me what to do. So, anyways. So then that night at 1 a.m., so because of the app, and I'm able to see like their progress notes, I'm able to see lab results as it results, and everything, even before the doctor tells me about it. So the nurse and I had talked. She kind of prepped me. I kind of knew what to expect. I kind of knew the cutoff. My numbers were, I think it was like 310. It was like right over 300. And so she's like, well, they might still send you home, blah, blah, blah. But, you never know. Because when I found out it was like 1 o'clock in the morning, and I got kind of tearful, and I was just like, oh my gosh. But before I got upset really bad, I had her come in and check my blood pressure. So I'm like, I know I'm about to cry and all this other stuff, because I really don't want to be here. I was 31 weeks and like 5 days at that point. So I'm like, I was really like thrown, And so they diagnosed me with pre-E. Actually, they diagnosed me with superimposed pre-E. Chronic hypertension with superimposed pre-E. So that's what they diagnosed me with, and that's what my treatment plan consisted of, was checking my blood pressure, my vitals every 4 hours in the hospital. I got ultrasounds twice a week. We did non-stress tests where you put on the band on your belly, and they listen for or they watch for the baby's heart rate and any contractions. They can see that too. We did that it started off twice a day, and then it increased. High risk recommended 3 times a day. So then it was more like breakfast, lunch, and dinner, and those, not those specific times, but like, that was the plan. And so like I had, so in the morning I'd wake up, order breakfast, eat breakfast, take my medicine, stress test. Not stress test. Then lunchtime came about 3, 4 o'clock. I would do it again because it was after lunch. So 3, 4 o'clock, do another stress test, and you would be on the monitor for like 15 minutes if they can see everything. If things get kind of crazy, then they will keep you on there longer. But if they can get everything they need to get or see, these accelerations and all that, meaning heart rate variability, like heart rate going up and all that stuff. And more technical, I'm not an L&D nurse or an antepartum nurse, so I understood it for what they told when they told it to me then, but to recap it now, it's kind of like, forget. But anyways, so about 15 minutes or whatever. And then then after that, medicine at night, and then all the doctors, consult people, ancillary staff will come in during the day too. So that was that. That's what landed me in the hospital for 3 weeks and 6 days. So it was pretty much a waiting game. So another question I have, or another thing I want to hear about from you guys in the comments, if you guys had any complications in your pregnancy that landed you in the hospital until delivery, or if it was after the fact, or if you were later on in your pregnancy, did you have to be induced because of pre-E? Like, was it advanced enough to have them, emergently take you back? Because that was always a risk too. Like the doctors, they told me that as long as everything goes okay, we'll keep you pregnant as long as possible. However, if things start getting kind of crazy, you start having persistent headaches, or your blood pressure is getting crazy and we can't get it under control, we're going to take the baby earlier than 34 weeks. Now, mind you, my personal goal, I wanted to get him to 34 and 6, like be induced at 34 weeks and 6 days. And then that way, by the time he is born, he'll be 35 weeks and hopefully not have to stay in the NICU. Not because I wanted him with me, and I wanted him to be able to come home when I came home. But it ended up changing. But wait, before I get to that, I do want to say, it was, everything was a waiting game, and it was, being in the hospital was difficult because even though I was able to binge watch some Netflix shows and, be on YouTube watching videos and, read if I could focus enough to read or write. And I thought when I first got in there, I thought, oh, I'll be able to do all the things that I say I'll never have time for. There were interruptions, but not in the way that it would be at home. So I'm like, oh, okay, I'll just use this time to, do everything I wanted to do. So I had like, a whole bunch of books. I had, my coworkers, they got me like an activity basket, things to do, which I did do some of those things too. But they got me that, and then I had my Fire Stick, I had my laptop, I had all my devices. I had my iPad, my phone, everything. Like, I had a lot of stuff to do. But then it ended up being all I was able to do was sleep. I was so tired. I felt like I slept so much, even during the day. And then by the time I'm like ready to wake up, like it's almost time to go to bed again. And then the medicine that I was taking, because I was taking magnesium pills, for my hip. I had like some like pelvic pain and stuff like that, so I was taking it for that. But that makes me sleepy. So by the time night shift came on and I took my nighttime meds, I'm ready to go back to sleep again. So, and then I was inside of the hospital. Once I walked in there at 31 weeks and 4 days, I did not go back outside. I think me and my husband went back out. He took me outside maybe like a few days before I was induced. It wasn't It's probably like the weekend before or something like that. But yeah, and that was the only time I had been outside, and you don't really realize like how important that going outside getting fresh air is until you can't go outside and get fresh air. And but I had an activity restriction. I couldn't. I could be up and around in the room and potentially on the unit, but I couldn't leave the unit without being wheeled down to the outside or in the cafeteria or whatever. With COVID and everything being kind of like, it's not over, but not being in the height of COVID, I was able to have my kids come. My husband was able to bring my kids to visit. So that helped, but they weren't really like a fan of coming to visit. So, but they would try to come on the weekends. And then, yeah, it was difficult. And then you get tired of like the same old like food and stuff like that. But, so yeah, it was trying to stay encouraged was difficult, but I was able to, because I'm like, you know what, I'm here for me, because I want to, I don't want to have a complicated stay. I want him to do well. I don't want him to have any issues. I want him to be born healthy. And so, I had to like keep that in focus, like the bigger goal in focus, but it was tough. It was really tough. So yeah, so that was that. So then so my goal was 34 and 6. I ended up changing my mind, and I changed my mind because my blood pressure started reading high again. I had headaches, like a consistent headache, like 3 days in a row, I believe it was. I had the Tylenol. Tylenol didn't work. Tylenol will work after I had 2 doses, I believe. Then it would happen. They did it like every 6 hours. I was allowed to have it every 6 hours. So it would work after that second dose. Then they were like, oh, okay, well, have you ever had Fioricet? Which I had. I had it with my first pregnancy. So with my first pregnancy, it helped. But with this particular headache, it didn't help that much at all. So they were like, well, we could try Phenergan. So I tried Phenergan. Was supposed to help with the headache. It helped a little bit. Then I had ice packs that I like was able to put on the back of my neck, and then that kind of helped a little bit too. And then so they were like kind of getting like, okay, we might have to do something earlier than 34 weeks, but we'll just kind of keep an eye out. And then so with my blood pressures rising, I mean, I had like a string of them that were 150s, 160s, and so I talked to my husband, talked to my parents, and kind of decided like, okay, it'll be better for him, for the baby, to be born, because he, at 34 weeks at the recommendation, because he will thrive. He will still thrive outside the womb, and but it's also in my best interest too, because complications of pre-E, some of them you could have a seizure. So this is from the March of Dimes, and I'm trying to, so this video also I'm doing for awareness, not just to share my story. Okay, so first things first, so symptoms of preeclampsia, besides high blood pressure, with or without protein in your urine, which, I don't know, I was on What to Expect, the forum, and some women, they would have the high blood pressure but not the protein in the urine, and their provider was just like, oh, we'll keep monitoring it or whatever, or monitoring your symptoms, and they didn't do anything. But I feel like definitely advocate for yourself, because it's a lot of these things happen, and it happens so fast, and you might not have all the symptoms, so it's better to err on the side of caution. So yeah, and if they don't do something, I mean, I would go to triage or go, I would get seen. And that's the other thing that I saw on the forum too, is like a lot of people would go to the forum to say, oh, what should I do? What should I do? And it could be like something that would be like, something that I wouldn't wait for people to respond on the forum. I would just call my OB/GYN, like the on-call, or I would just go to triage. I feel like when it comes to your health, don't wait, don't ask, your friends or wait for your friends or family to respond. If you're that concerned, go get seen, go get checked out, go to ER, go to urgent care, call your doctor, like get help when you need it. But anyhow, I'm gonna keep going. Okay, so high blood pressure, changes in vision like blurriness, flashing light, seeing spots, or being sensitive to light, a headache that doesn't go away, nausea, which is like feeling sick to your stomach, vomiting or dizziness, pain in the upper right belly area or in the shoulder, which they ask me that a lot, like under like your right rib, you have pain. Sudden weight gain, 2 to 5 pounds in a week, swelling in the legs, hands, or face. My facial swelling was not like, I felt like it was puffy, but then like when I sleep and wake up, like like my face normally swells a little bit anyways, but I didn't really notice. I felt like it was swelling, but I wasn't for sure. And it wasn't until after I had him that I realized like it really was swollen, because like before I had him, like my glasses would sit like right here, and I had to push it up occasionally and no problem. But after I had him, like I had to like, my glasses would keep falling like on my nose, like down here, and then like I'd always continuously push them up, and I'm like, and I kind of noticed that even now I kind of notice a little difference in my face that is down, considerably compared to what it was when almost 8 weeks ago. And then trouble breathing. There's also symptoms too. And then let's see. So how it can affect you and the baby. So this is why it was so important. So it can cause, preeclampsia can cause kidney, liver, and brain damage for the woman. Problems with how your blood clots. It says a blood clot, well, it says what it is, but it says it can cause serious bleeding problems. It can progress to eclampsia, which is when a pregnant woman has seizures or a coma after preeclampsia. And it can also cause you to have a stroke. For the baby, it can cause preterm birth. Because you might need to be delivered early because of to help prevent serious health problems and stuff for you and the baby. And then it can cause placental abruption, which is when the placenta separates from the wall of the uterus before birth. It can separate partially or completely, and this can cause the baby not to get enough oxygen or nutrients. And a lot of times, vaginal bleeding is the most common symptom of that abruption after 20 weeks of pregnancy. And then it can also cause intrauterine growth restriction. That's when the baby has poor growth in the womb. So when the mom has high blood pressure, it narrows the blood vessels in the uterus, in the placenta. And then the placenta, it grows in the uterus and supplies your baby with food and oxygen through the umbilical cord. So if it constricts, if it gets smaller, then your baby doesn't get enough oxygen and nutrients, which may cause him not to grow as well, which could also be a reason why they could, depending on how bad it is, they can also be delivered early for that. And then it can also cause low birth weight. And then it says having preeclampsia increases your risk for postpartum hemorrhage. It's rare, but if not treated, it can lead to shock and death. So yeah. So it's really important that they catch it early, treat you, and deliver when it's recommended. And so when I started having more symptoms, I was like, okay, I'm just gonna go with the recommendation. I'm not even going to try to push it or anything. So this is your induction. I was induced on May 6th at 34 weeks. I got to the labor room. Inductions take some time to get started. I got checked, which was crazy, just to see where I was at. I think I was only like a half of a centimeter, if that. And for some reason it hurt like crazy. Yeah. Anyways, so okay, so I won't go into like all the details, but I will just say like I had to be on mag for 24 hours. So they say mag makes you feel like magnesium, I believe sulfate, I had to be on for delivery. So they started the Pitocin and the magnesium at the same time. I believe. Well, anyway, yeah, around the same time. And I had to have a Foley in as well because after the mag started, I couldn't get up anymore. So I had to be in the bed like until they took it off and I got my legs back. For 24 hours from delivery. So yeah. Anyhow, they started the Pitocin in the mag at the same time. I was having little cramps or whatever, nothing crazy. They started slow because Jeremiah was having some decelerations, heart rate dips on the monitor, and so they were kind of taking it really slow because they didn't want to stress him out and all that. So they bumped it up gradually as he was able to tolerate it, and then they also had to lay like on my left side and on my right side, and they had a position I hadn't heard before, which was called the throne position. So the labor bed was how I'm sitting up like this. It was able to go into a sitting position as if I was sitting in a chair, and I thought that was pretty cool. I've had 2 full-term births, and I've never like heard of that before. So I went into that position, but he didn't like that too much. I had to stay on the monitor. I had to stay on the monitor with him with the tachometer on my belly with the bands and all that. I had to keep that on the whole time. But for MAG, they prepared me to say like it's going to be like you got the flu. You might feel like you're just really out of it and all that. When they first loaded it on, like they do a loading dose, I went to sleep. Like I slept, but I didn't feel, even after I had him, like I didn't feel any type of way. Like I felt like my normal self. So I was glad that I didn't experience the feeling sick and all that jazz. The thing I was scared about the most was the epidural because when my first son, it was fine. I didn't have any issues with it. With my second son, it hurt like heck. It's not a stabbing pain, but no, that pressure pain, it just I didn't like it. And then on top of that, it didn't even take to the one side, so it made birth kind of crazy for me. Even though I had the pump, like my right side kept getting numb, but I felt everything on my left side. So I was a little nervous about the insertion and the if it would take effect, like if it would work as well. So, but it did. So, an anesthesiologist put it in, and it wasn't that bad. It nothing like the second experience. And then I had the pump too, and then and yeah, that was it. And when I needed more pain control, which I did, they were able to give me a bolus to get my pain under control. I was able to actually have I had 2 boluses as well as pushing the pain pump button. And then by the time I had the second bolus, like I was good actually. Before I even was able to, I didn't feel anything at one point, like right before it was time to push. But before I get to that, I want to say that I had a doula, and so my doula story will be in the next video. So I want you guys to watch this video to the end, but then also subscribe or put your notification bell on so that way you can hear my experience about having a doula and why I recommend it for you to have, for you to have one, because it was helpful to me, and I was grateful for it, for having one. So once the epidural went in, and my doula she arrived like right after my epidural, so she was able to. At first, I was kind of like, well, I don't know that I was still, I didn't think there would be much she could do for me at that point. And after I got the epidural, and I was on MAG, I can't get out the bed and this and that. So I'm like, what are we going to do? But let me tell you, she got my labor progressing. Like I had awesome labor and delivery nurses, but to be honest, like your labor and delivery nurse, like they're not in there with you, like constantly like your doula is. Your doula is in there with you from the time that she arrives until the baby delivers. So, because your nurse, you know, she has to charge, she has to go get orders, and she, you know, she's running in and out and doing other things. So it's not like she's right there with you every single step of your labor to, you know, reposition you every so often or whatever the case is. I mean, they reposition you and give you like the birthing ball and all that, but they're not in there with you like your doula would be in there with you. And so, but I was able to get a birthing ball, which I never did out of all of my pregnancies, my term pregnancies. I didn't get to do the birthing ball. So I did that, which I just laid on my side and they put the ball in between my knees. And then when my doula got there, she kept me turning, you know, side to side, like every 15 to 20 minutes. And then we did some other positionings, like where, let's see, I think my back leg was out. It was like almost like a running position. So like my one leg was on the ball, my other leg was like stretched out. I don't know if you guys can see me do this. But anyway, I was on my side. On both of my sides I did that. And that, my right side was okay, but my left side, when I was on my left side, like I had the most pain. And then I felt my water was breaking, but it wasn't my water. I was just having some cervical change, I guess, which was causing bleeding, which made me feel like my water was breaking, which I never experienced that before during an induction. But this induction was unlike any other induction because of my doula. So if you can, definitely get a doula. I'll talk more about it in the next video. But so, anywho, so I got my second dose of my epidural, my second bolus of my epidural. At that point, I was tired. I think I fell asleep. And they were like, oh, I remember them waking me up like, okay, well, we should probably check you. And they put the non-rebreather mask on me for oxygen because, you know, it must have been because Jeremiah's heart rate dipped. So they put that on, and so they checked me and they were like, oh yeah, we're gonna need to push. And so, because he was like literally right there, and my husband was like, yeah, 18 seconds. That's how long it took. 3 pushes in 18 seconds, and Jeremiah was here in the world. So yeah, and he did have his cord around his neck, which could explain, you know, some things, you know, as far as the heart rate dips and all that jazz. He had his cord around his neck, but they put him right on me, and then I was able to help, you know, them, you know, dry him off, but also look at him and stuff like that. And because NICU was there, the NICU nurses were there at the delivery, so they took him over to the warmer and started working on him. He ended up doing some work on him. I'll insert some pictures, giving him some breathing support. They ended up putting him on CPAP. And they put him on CPAP and got him up, his oxygen up and everything. So I wasn't able to do skin to skin after birth. They were able to hold him up for a little bit for us to get a picture with his weight. And then after they got him all situated as far as like the CPAP on and secure, they wrapped him up and all that jazz, and I was able to hold him for like maybe 3-4 minutes or whatever before they took him to NICU. So I was glad to get that experience, because that was one of the bigger reasons why I didn't want him to go to NICU, because I knew they would have to take him away, and then with being on magnesium, I wouldn't be able to see him until 24 hours from the time that he was born. So Jeremiah was born May 7th at 8:19 a.m. So the magnesium would be turned off that day at 8:19 a.m. even though it didn't start at 8:19 a.m. the previous day. Like it started, you know, when I got induced, when I, you know, hooked up everything. And so I couldn't see him until Sunday at 8:19 a.m. I couldn't go out of my room until then to see him. And so other than that, so I had to let's see, I couldn't see him until Sunday at 8:19. He was born 5 pounds 1 ounce, which was a pretty good size for 34 weeks. I ended up getting a total of 3 betamethasone shots. And I know this is kind of out of order. But I got 2 when I was first admitted to the hospital. They gave me 1 that night in triage, and they gave me the next one the next night because they have to be 24 hours apart. And then I got another shot when I went to my labor and delivery room. And then to kind of help give them that extra boost. Oh, and I had to, so I had to stay in the bed and all of that until the mag came off, and I still had the catheter in. And then I had to pump because even though when he went to NICU he was NPO originally, eventually they were going to start feeds, and so another nurse recommended to me, a labor delivery nurse recommended to me to pump right after delivery. They're going to take him, and once I get all situated, to start pumping like right then and there. And that's what I did. And so I'll put like I'll show you guys what I got, when I first started pumping, which was awesome because like my supply, like it came in, it showed out, and it's still doing like decent now. I think the only reason why it's kind of like, a little shaky is because I'm just not pumping like I was in the beginning. But yeah, so my supply came in really good. I was getting those syringes, sending them down for mouth care, for them to use for mouth care. And then when he was finally able to eat through his feeding tube, I had enough for each feeding, volume that they gave him. So he never had to have donor milk or anything like that. So, or, formula as a substitute for my milk if they didn't have any. But he never had to use any of that. I know I was super anxious to get out of there. As soon as they took that stuff off, I was like, all right, take me to my baby. And I was down there first thing in the morning, as soon as they took that mag off. And he's doing good. He did good. I will do another video on his NICU stay specifically. So there's 2 more videos coming out after this video. There is my experience with the doula. So look for that, part 2 or 3. And then about Jeremiah's NICU stay. Both of those videos, I don't anticipate them being this long. So unless you guys have questions for me. So if you have a question about my birth story or my pregnancy or anything that I didn't already talk about, make sure you put those in the comments. I just want to share my experience. I want to raise awareness because all of it snuck up on me. I didn't have a hospital bag packed. I wasn't prepared at all. And I walked in one day and didn't walk out until 3 weeks and 6 days later. So, but the good thing is that I walked out because, a lot of women don't, or it gets too far along, or there's other complications that for some reason they don't make it back home, so. But yes, so that's this video. I do talk about my birth story with my first son. I didn't do YouTube with my second, but so I will link my first birth story, labor and delivery video in this video, and then I will catch you guys in the next video. Thanks for watching.